And time now for Sunday House Call, your one stop for everything you need to know to be healthy this week. Joining us now this morning, Dr. David Samadi, the Vice Chairman of the Department of Urology, Chief of Robotics at the Mount Sinai Medical Center.
And Dr. Mark Siegel, who's Associate Professor of Medicine at the NYU's Langone Medical Center, and he's the author of the Interpulse, Unlocking the Secret Code of Sickness and Health. Morning, docs.
Good morning.
And your two chief residents. We're really coming along, I think.
You promoted yourself.
Yeah, I know. We passed over the internship. All right, let's get started.
I hope you're doing a surgical training.
Now, don't battle over me. Surgery, medicine, dermatology, no house call. Okay. New research raising some red flags on prostate cancer. I want to get right to this because this really concerns a lot of men. According to specialists, a specific drug that's used during that treatment may lead to stroke and heart disease. Dr. Samadi, what do you want us to know about this?
Well, when it comes to prostate cancer, you can have a very early stage organ confined, meaning that the prostate cancer could be in the organ, and the best treatment for that is to really remove it. If the cancer is spread, whether it's gone to the bone or it's outside the prostate, then you treat it with radiation plus hormones, or if it's gone to the bone, which is already too late, you give them this hormonal treatment. The idea and the fuel behind prostate cancer is testosterone. So by bringing the level of testosterone down, you delay the progression and patient may end up living longer. Now we're finding out from the studies coming out of Sweden, they looked at 30,000 men that went through these hormonal treatments, and over 40% of them ended up having heart attacks, stroke, and real significant findings. So we're helping them with prostate cancer, but now they're dying from cardiac issues, very significant. We know that low testosterone can affect insulin and cause diabetes and other issues.
That's a catch-22. You got to lower the testosterone, yet without it you have all these issues. What do you monitor patients?
Absolutely, and I think, and I agree with David on this, there's no free lunch in medicine. You know, we've spent so much time talking about how long you live that we're losing sight of the fact it's how you live. People out there need to know that if we delay your diagnosis on something like prostate cancer, by not doing the PSA, as David and I have discussed, you end up with late prostate cancer. 1/3 of all prostate cancer is advanced at the time of diagnosis. So what treatment are you getting? Androgen suppression therapy, which we're talking about, lowers your testosterone, lowers your triglycerides, lowers your cholesterol, increases your blood sugar, can definitely lead to heart disease, stroke, and diabetes. So you're living on, but you're living on in a state where you have more risk of a heart attack.
So what do you do? What do you tell your doctor? What do you ask for?
Well, it's the biggest message that we're getting out of this study is that perhaps the world of urology and cardiology should come together. And before starting this patient on these hormonal injections, perhaps we should do a good cardiac workup. Find out if they have any underlying disease before we put them on these medications. Follow them very closely. The other thing that comes up is osteoporosis and fractured bone in these men are also a big issue. Look, it's a good therapy when it's already too late. But you want to make sure that you catch it early and give them a definitive therapy.
And what you've clarified over the last couple of weeks is even though the regulations or the recommendations changed in terms of getting the PSA screening, you're big believers in the fact that men should go.
Well, yesterday we also showed that according to National Cancer Institute, the mortality death from prostate cancer is actually going down as a result of all the screenings. So I've always been a big advocate of